Good morning, good afternoon, good evening, everyone. Thank you for joining this webinar. This is the fourth webinar in the webinar series on sustainable financing, focused specifically on developing funding proposals for the Pandemic Fund second round. The purpose of these webinars is to assist countries in developing successful proposals or national plans for sustainable financing for health emergencies. The audience for these webinars is you, particularly those leading or supporting national efforts on sustainable financing. Today's focus is on the technical areas of labs and surveillance, which are key focus areas of the Pandemic Fund second round. Specifically, the objectives for this webinar today are twofold. The first one is to highlight practical considerations for developing strategic objectives, goals, and key activities in country proposals and plans related to labs and surveillance. And then second, to share a country as well as regional experience in developing proposals with a focus on labs and surveillance. I am joined today by a few experts. The first one is Dr. Nadret Emirulu, who is the Director of Country Readiness and Strengthening at WHO headquarters. Then we have Dr. Sebastian Kone, who is the Unit Head for Public Health Laboratory Strengthening at WHO headquarters. Brett Archer, who is an epidemiologist for surveillance systems at WHO headquarters. Dr. Arun Govindakanara, who is a technical officer on labs, joining us from the WHO country office in Nepal. And then we have Dr. Masaya Kato, who is a program area manager for health emergency information and risk assessment, joining from our WHO regional office in Southeast Asia. In addition, we're also joined by a team of experts from our various WHO regional offices, including Europe and the Eastern Mediterranean region, as well as an expert from headquarters. My name is Nana Mensa Brampa, and I'm a technical officer within the Strategic Planning and Partnership team within the WHO Health Emergencies Program at WHO headquarters. Throughout the webinar today, we encourage you to use the Q&A function at the bottom of your screen to send any questions for our speakers. We will have a moment after the presentations to be able to address your emergent questions. Similarly, we will be sharing the recording of the webinar as well as any associated slides and resources following the webinar. With that, I would like to turn over to the first speaker, Dr. Nadret Emirulu, who will give us some opening remarks.
Thank you very much, Nana, and good morning, good afternoon, good evening to you all joining us with this webinar. And it is going to be focusing on a very critical area, as we have seen from the COVID pandemic, as well as other infectious disease outbreaks. The role of surveillance laboratories is critical. And I'm grateful to the Pandemic Fund Secretariat, which is prioritizing surveillance and laboratories together with the health workforce, also during the second round of investments. And from our various interactions with the member states, partners, the needs and expectations in the area are immense. And I'd like to, as Nana did, would like to remind you that this is only one of the technical support week items. And I also welcome the colleagues joining in the upcoming session. So the future ones are equally important. So please try to join the ones on health workforce, cross-cutting issues, and looking into also the implementing entities this week. And as mentioned, please, those who missed it, please, you can follow up and catch up via the recordings. So in terms of surveillance, one critical lesson that we have learned from the pandemic was that no one surveillance system or public entity working in isolation can address all the questions and information needs arising either before, during, and after the pandemics and other health emergencies. And we know that it's critical that we continue to build stronger and more integrated surveillance systems, as well as those capacities. And at the same time, we should look into and focus on strengthening collaboration at all fronts to address these needs and inform better decision and actions during the emergencies. That's why the collaborative surveillance is a critical core element that we see within the health emergencies, preparedness and response global architecture. And in terms of laboratories, I think it's the same. We have been investing a lot in the recent years, particularly this has been boosted during the pandemic. And this has led to stronger capacities together with the surveillance systems to detect early and respond early. But at the same time, the laboratories helped us to characterize and monitor many viruses, particularly with the respiratory viruses, either influenza, SARS-CoV-2, and also the tools like genomic sequencing became much more accessible. We are at a juncture now that we have to leverage these investments and opportunities, and we must recognize that many countries struggle to sustain all these capacities with fragmented and purely financed systems. And the pandemic fund actually can help supporting these gaps. But it should also be an opportunity now to strengthen, to address and strengthen the foundations of strong public health laboratory services through improved governance, predictable financing mechanisms, better integrated networks and platforms. I have to also acknowledge the role, critical role of the highly skilled workforce coupled with all these incentives, which requires us to have mechanisms in place for staff retention as well as career development opportunities. So we strongly encourage all member states and partners to consider the collaborative surveillance concept paper that WHO has issued, together with the national and subnational systems, to address the systemic surveillance and laboratory weaknesses in developing your pandemic fund proposals. And these are areas that are key to preventing and improving preparedness and readiness, not only for the next pandemic, but the health emergencies we all face every day. Thank you for being with us, and back to you, Nana.
Thank you, Dr. Nedret, for those opening remarks. We hope you'll stick around for the Q&A session as we get there. We'll now turn to our two experts who will be focusing on labs and surveillance. So over to you, Brett and Sebastian.
Hi, good morning, colleagues. Absolute privilege and pleasure to be joining you today. I'll speak on the surveillance area, and then I'll turn over to my colleague Sebastian to speak more in depth about the laboratory strengthening aspects. So without further ado, can we jump onto the first slide, please? So just to remind colleagues that there's these three major areas of the pandemic fund, three priorities that they're focusing on. The first one focusing on early warning and disease surveillance systems. Second one on laboratory systems, and the third one around more the health and community workforce. We'll speak on the first two, and tomorrow's session will be focusing on the third one. Just to highlight that while we're going to be talking primarily about sort of the human and public health systems and strategies, the pandemic fund does encourage consideration for a more broader approach around the One Health arena. So we'll speak primarily on these, but absolutely critical for surveillance to be triangulating data from the human, animal, and environmental health side as well to ensure that we have that sort of robust understanding of the risks, the context, and the best strategies to control emergencies moving forward. Next slide, please. So there will be four sort of critical areas that we can review to consider which local priorities, to define your objectives, to specify the exact activities that can respond to health emergencies moving forward. And so doing this, given public health surveillance is an sort of inherently complex arena, there's many different factors to consider. So we try to identify what are those sort of four critical areas to consider that will help define priorities. So the first one up on the screen already is the sort of existing pandemic fund priorities. Now, the Secretariat has put out some pretty good guidance specifying the types of surveillance activities, providing case studies, providing frameworks for evaluating proposals, and demonstrating results. I do encourage that you look again at these as you're reviewing your proposals, and much of this was covered within the first webinar. So if you missed that session, please do catch up. The next sort of critical area is around your recent national capacities, risks, and vulnerability assessments and operational plans. Again, colleagues covered this in the second and third webinar, so please do watch those. But I'd like to add from the surveillance perspective that it's really critical that your systems adequately address the local prioritized hazards and risks. And this could be derived from a exercise such as the STAR analysis that you may have gone through already, but other sort of activities that have defined your national notifiable disease lists, and whichever sort of local priorities that are faced by your communities. Also, that to consider sort of the key surveillance systems and broader capacities that are available to inform decisions from your recent outbreaks, as well as simulation exercises, as well as key recommendations arising from any recent surveillance system evaluations. Ideally, we want the findings. Ideally, these findings would be considered already within your local national action plans, but it's always a good idea to revisit these outputs and ensure that these activities plans address those specific areas for surveillance and the areas of greatest need for surveillance strengthening. The third critical area is around regional priorities. So by aligning your key surveillance strategies with the regional priorities, you can best leverage the existing resources that are available, as well as the ongoing activities to strengthen these. This would include support provided by regional offices, as well as other public health entities within your region. I think there is technical focal points already being identified within all 6 WHO regional offices to assist with any questions as you are walking through your proposal. And our colleague Messiah Kato is joined online to speak further on some perspectives from the Southeast Asia region later in the session. The fourth area, I'll spend a little bit more time talking in the upcoming slides, is the global guidance. Now, this includes some cross-cutting surveillance guidance that is available that looks at IHR core capacities, the HEPR space, the health emergency preparedness, response, and resilience space, as well as One Health perspective. But there's also a wide series of area and disease-specific technical guidance that is available should your priorities focus on any one given hazard or groups of hazards. I'll speak more about these in the coming slides, but just to highlight that together, these 4 sets of resources can be used to identify, refine, and pressure test your objectives and your activity plans. And where possible, I really do encourage you to highlight the linkages to these specific areas in your proposals moving forward to provide them a better chance of success. Next slide, please. So the pandemic fund guidance makes reference to this concept called collaborative surveillance. And I'd like to unpack this in a few minutes. Essentially, collaborative surveillance is one of the 5 major system components that underlines the proposal for strengthening the global architecture for HEPR, or Health Emergency Preparedness, Response, and Resilience. And this concept paper defining collaborative surveillance was published after extensive consultations, applying the lessons from COVID and other major emergencies on how we can better move forward the area of surveillance to address many of the shortcomings and challenges that we all faced during the pandemic. This document describes the core concepts, objectives, capabilities, enablers, sub-capabilities needed to really enhance public health intelligence and inform better decisions during emergencies. Next slide, please. There's a lot to unpack within that concept, and I think most critically is to understand that that there is a need to specifically drive both increasing capacity and strengthen collaboration. So most surveillance strengthening activities over the past few decades have focused primarily on enhancing that sort of surveillance capacity. So the workforce, systems, tools, networks that are necessary for us to be able to respond and collect data, process that, and output it. But while it's critical that we continue to enhance these areas, it's also critical that we focus intently on strengthening collaboration. And this is really trying to address one of the key lessons out of the pandemic, is that no one surveillance system can give us all the answers. We really need to be looking at diversity of resources in order to be able to address all the information needs. The concept paper goes on to define these 4 critical areas of collaboration. Do consider each of these as you're going through your proposal. Do you address collaboration, for example, across the disease and threat spectrum? So addressing multiple systems across sectors. So taking a One Health approach, but also looking at other sectors, involvement of private sector, involvement of industry. Across the emergency cycle. Now, the Pandemic Fund does explicitly call out early warning, and this is absolutely critical, but just also recognize that there are questions and information needs throughout the emergency cycle. Is your surveillance systems adequate to inform, for example, who are your key risk groups during the course of an emergency? And if it's not, maybe that's an area where it's worth focusing on in addition to the initial detection of an emergency. And last but not least, the collaboration across the geographical levels. So looking intently at your local level, are they receiving and providing the right information to be able to inform active decisions in real time at the local level, and then having that information flow in 2 ways across the different levels to ensure that those same decisions can be made most robustly across the different geographical levels. Next slide, please. The concept paper also goes on to define sort of specific objectives, capabilities, and sub-capabilities. Please do look at these resources if they are a source of inspiration, or if there's a source of just pressure testing what you've already decided in terms of your national priorities. But really do consider that while we can strengthen the surveillance, the national integrated surveillance structures, we can strengthen laboratory, we also need to think critically about the capacity to be able to digest all this information. So that third objective of collaborative surveillance really focuses on that building the public health intelligence capacities to be able to translate all the surveillance data, all the other information sources into concrete decisions and ensure that those information are communicated to decision makers that need them in a timely manner. Next slide, please. And finally, from my side, just to highlight, I know Nirmal spoke in detail about the indicators that are being prioritized for the Pandemic Fund. Please do reference these explicitly. There's also the availability of the WHO benchmarks, which we have recently updated, should you need to help identify potential priority actions that could be helping you move from one level of the JE or SPAR scores to the next. But just really to highlight that these do focus in on a specific area of IHR capacities. This is important, but at the same time, surveillance is much broader than that, and we need to consider the broader capabilities. So prioritize these, but don't limit yourself to these indicators to be able to progress your surveillance action. That's it from my side. I now pass on to Sebastian to continue. Thank you so much.
Thanks, Brett. And good morning, good afternoon, good evening, colleagues. It's a great pleasure to present these few slides on laboratory system strengthening. Next slide, please. So as Nedret mentioned, and Brett as well, so I think we all agree that the overall objective is to make sure that laboratories and the laboratory system and services are ready to detect and respond to epidemics and pandemics faster, earlier, and safer. Next slide, please. So Brett already mentioned that the proposals should be aligned with the indicators that have been proposed in the joint external evaluation, as well as the PVS, the performance of veterinary services. And there are 5 indicators that relate to, 4 indicators that relate to laboratory systems, the JEE D11, D12, D13, D14, and there are 2 indicators on biosafety, biosecurity, and 1 is for veterinary laboratory diagnosis. Next slide, please. So I think I wanted just to give you some key consideration. A lot of investments have been made these past years or even decades, but often for specific disease, influenza, polio, measles, and more recently, obviously, SARS-CoV-2. And there are mechanisms that continue to support these disease control programs. But I think the pandemic fund is really a unique opportunity to have a more system strengthening approach for the lab systems. So what do we talk about here? So we talk obviously about infrastructure. We talk about the workforce development. We talk about laboratory information management system. We talk about quality management system to improve the overall confidence in the laboratory results. And we talk about biosafety, biosecurity to protect laboratory workers and the community surrounding the laboratories. And all of that depend on strong governance mechanism, very clear and ambitious policies that are supported by up-to-date legal frameworks and regulations. And I think this is very important that countries don't forget these enablers, because without that, any investment will not be sustainable for the rest of the laboratory system. We also encourage you to really engage, and we know you already do that, with our WHO country offices and regional offices, because countries don't start from scratch. And as Brett mentioned, there are already a lot of regional strategies and initiatives, including laboratory system strengthening, that have to be used and leveraged to move forward and strengthen your laboratory system. Next slide, please. So sorry, the slide is a bit text heavy, but these are really the main focused areas that we would like countries to select for the pandemic fund. The first one is really ensuring innovative and quality assured public health laboratory services. That include the deployment, the utilization, the sustainment of modern, safe and accurate and affordable diagnostic tests and devices that can be really deployed and decentralized and complemented by more sophisticated techniques at the national reference laboratories or public health laboratories, such as genomics or some phenotypic characterization. And of course, biosafety, biosecurity system strengthening should accompany these efforts throughout these processes. The second piece is to strengthen laboratory networks, connecting different sectors and really decentralizing the testing capacity, because we have seen during the pandemic, that many communities could not access diagnostics that is going to inform not only their individual care or the local public health and social measures, but also the surveillance system. The third point is to develop a highly competent and empowered laboratory workforce. So we see a lot of countries proposing trainings. It's very important to develop capacities on the bench for the diagnostic of many diseases. but it's also very important to train staff on good quality or good management practices and leadership capacities to lead the system strengthening efforts. Laboratory data management are very important because this is what is ultimately used for public health action. But please don't forget also to feed back and to provide data to the community, provide data to the physicians, and not only to the surveillance system upstream. This is very important to go up and go down when it comes to data sharing. And the last point is to, of course, look at preparedness and capacity building for this area. But don't forget to test your system to see if the system is ready. And there are a lot of efforts that are done to develop scenarios and support implementation of simulation exercises, and also to enroll laboratories in external quality assessment program to test their capacity to diagnose this disease. Next slide, please. So these are examples of key activities, and my colleague Arun will show you how it has been done in a country like Nepal. But just to highlight a few propositions, establishment of integrated specimen transport and referral system, going beyond also even epidemic-prone disease, but including all the infectious disease, TB, HIV, that have very strong system on that, designated and capacitating high-quality national reference laboratories for pathogens of epidemic and pandemic potential, developing and implementing national testing strategies, an algorithm, and that can be supported by an essential diagnostic list that will be deployed across a tiered laboratory network. The Global Laboratory Leadership Program is an initiative that can help supporting or developing a new generation of One Health laboratory leaders. Functioning lab information system, I mentioned that. Provide access to external quality assessment scheme, I have already mentioned that. Test your systems through CIMEXes. Develop and implement national genomic surveillance strategy. Develop risk-based biosafety guidelines, standards, and regulation. And something that is forgotten is also to establish laboratory incident reporting and response system for high-threat pathogen, because this is the only way to understand if your biosafety and biosecurity practices are functional and relevant. My next slide and last slide is just to list some resources that are on our WHO website. The benchmarks have already been mentioned by Brett. We have also a website for the Global Laboratory Leadership Program. We have also the Laboratory Biosafety Manual and other guidance on how to develop genomic surveillance strategy at national level. Thank you, and over to you, Nana.
Thanks a lot, Sebastian and Brett, for that rich presentation, which really outlines the key considerations that countries should be reflecting on as they develop their proposals, looking at labs and surveillance in mind. Again, for the audience, if you have any questions, we would love to hear from you. So please do use the Q&A function to share your question. From the global level, we are now going to head over to Nepal to hear about the country experience that they had specifically as they were one of the successful countries who managed to get some funding from the first round. So we'll hear from Dr. Arun, who is the technical officer focusing on labs within WHO's office in Nepal. And then we'll also hear from Masaya Kato, who is based in our regional office in terms of that regional level experience looking at this specific focus areas. So over to you, Dr.
Arun. Thank you, Nana. Thank you, Brett, Sebastian, and Masaya for this opportunity. We can move the slide to the next one. Yes, next one. Yes, the year 2022 was very special for Nepal. We were not anticipating pandemic fund, but that was a year where we could complete all the 4 requirement of IHR, International Health Regulations, Monitoring and Evaluation Framework. Of course, this did not happen overnight. This was a work started in 2019, when first time government expressed an interest in doing a joint external evaluation, but then COVID came and took some time. Different waves of COVID. Actually, when the COVID waves were going down, it was our country office was engaged with the government, and they were more receptive in conducting an IHR monitoring and evaluation framework activities. That resulted in completing all the 4 requirements in 2022. So the pandemic fund announcement came in a very right time, where Nepal had sufficient external evaluations and internal evaluations conducted in a multi-sectoral way. And many of these evaluations, or most of these evaluations, had recommendations. So these recommendations were consensus recommendation agreed upon with the multi-sector, particularly the human health sector, animal health sector, etc. So this has really helped Nepal to put up a good application. Next slide. So, this slide just shows the theory of change, how the pandemic fund made it, will expected to make a change. So this picture or this diagram just shows that how the activities leads to outputs and outcomes, medium term and long term, and ultimately the impact, causing the impact of reduced health, social and economic impacts of epidemics and pandemics. So you can also see that apart from the pandemic fund, even though the pandemic fund may be pushing the maximum effort, you can see from the sidewise co-investments and co-financing coming from government as well as other agencies as well as the implementing entities. So we were also cognizant of the fact that several agencies also supporting the government on these same areas, and government also has some investments in these areas. Next slide. So our first aim was to identify the gaps and make the activity mapping. So of course, we used the IHRJ recommendations as the primary source for identifying the gaps and coming out with the activities, because this is something which was recently done in 2022 November, December, and it's a consensus between both the human health sector and animal health sector. And several other assessments were also available from the animal health sector. The PVS assessment was available, even though it was little older. And other recommendations we put together, and we developed objectives based on the surveillance for the early detection and laboratory capacity building and human resource capacity building, and defined the activities and timeline. And we also has consulted with the various developmental agencies and other international organizations supporting in these areas in Nepal. Moving to the next slide, that was the main considerations we gave, that we took the JE as tool as the main indicator. So how to increase the level? So for example, from this picture, you can see that laboratory, it was something around 2 to 3. So our intention was how to take this 2 to 3 to a level 4. So up to level 3, it is basically at national and subnational level. But when you talk about level 4, you have to go to the local levels. So this was our guiding principle. Going to the next slide, we had several consultations with the stakeholders. And with the government stakeholders, we looked at the activities based on both JE recommendation, JE indicators, as well as PVS indicators. Which activities or which indicators we can really move to one step higher, because several activities we cannot move. For example, biosafety, having a national law is an essential condition for moving from 1 to 2. So it was not possible for Nepal to make a law within 3 years. So we did not take up biosafety for that matter. So we limited only to the laboratory capacity building and surveillance and some of the human resource development. So this was the major activity which got the consensus, and consensus was much easier in Nepal because of the previous JE assessments where all sectors were involved and it was very recent. Moving on to the next slide. So this shows the different steps we conducted, like inception, submitting an expression of interest, getting the other implementing entities like FAO and UNICEF got interested in this. So we jointly put up the application with the WHO, FAO, and UNICEF, and proposal development in consultation and stakeholder meetings. Considering various recommendations, provincial consultations, and then of course regional consultations to put it into the regional roadmap, etc., to be considered while developing this proposal. Next slide. Next. So coming to very specifics of the techniques, how did we handle it? So we have identified the laboratory systems JD 1.1. Sample transportation is the first aspect. So you need to have a standardized, systematic referral and sample transportation. So the human side, the WHO taken, the lead in, helping the government counterparts to develop these objectives, where coordination of sample transportation, including the quality maintenance, etc., at all levels. All levels, when I say it is national, provincial, and local level. And animal health focused on their areas. And then environmental health was handled by the UNICEF, or supported by the UNICEF and the Department of Water Supplies and Environment. So all the three areas we focused on how to collect samples, how to transport samples in a safe and in integrated way. Moving to the next slide. So the second one area focused was quality. So how to improve the quality of the laboratory, internal quality, external quality, laboratory licensing, etc. So the same thing, three implementing entities supported the government in developing three different areas: human health, animal health, and environmental health. Moving on to the next one, next slide. This is diagnostics, how to improve the diagnostics, capacitating the national laboratories at both the human health side and animal health side with all possible tests for emerging pathogens and selected tests to the subnational laboratories or provincial public health laboratories. Animal health side also have provincial or zonal laboratories, so they also have taken up that area. So this includes training, manpower development, training, etc., reagents and logistics for that. And environmental health side will be focusing on wastewater surveillance, water testing, and that type of activities across the levels. Next slide. This was basically focused on the laboratory networking, where internal national networking and also joining the international laboratory networks, all three different areas, because networks are very, very important to be making it effective and efficient for rapid diagnosis. Moving to the next slide. So these are some of the monitoring and evaluation. So of course, the primary monitoring and evaluation tool is the SPAR, which is an yearly mandatory IHRJ reporting. In addition to that, we had proposed a variety of monitoring and evaluation mechanisms, and now we are aligning it with the pandemic funds requirement. Next slide. So basically, the success of the funding request, we feel that it was a proposal address the needs identified through external assessments, and it is explicitly linked in the application to different assessments and JE indicators or PVS indicators to make it very clear. Proposal aligned with the national strategic plan or policy demonstrating support. So basically, we are not identified any new activities. It's all previously identified activities, multi-sectoral collaboration, consultation with external development partners, and having a clear monitoring and evaluation plan, and also proposal aligned to the donor priorities, the pandemic funds priorities, how they evaluate, how the evaluation criteria is there, so to align with that. I think this is the last slide. Next slide. Thanks to all our colleagues. Next, over. Thank you. Back to you, Nana.
Thanks, Dr. Arun, for highlighting the Nepal experience. I believe now we head over to our regional office colleague who's joining us from Southeast Asia to be able to hear more about how the global level activities and strategies have been contextualized within the Southeast Asian context. So over to you, Masaya.
Thank you very much. I was asked to focus more on how we are preparing for the second round of the proposal for pandemic fund. And then I have only 3 slides, but let us start with some background, how we sort of consolidated lessons learned from this pandemic and other emergencies. It was 2021, we convened a regional meeting to really synthesize some of the learning from this pandemic response. And this was converted to a overall regional strategic roadmap on health security, health system resilience, which was endorsed by regional committee in 2022. And based on this, the regional action frameworks developed for laboratories as well as surveillance. And then these were largely aligned with the global HEPA framework, but also it strongly promotes multi-source collaborative surveillance approach. And then when it comes to like this opportunity for pandemic fund proposals or other resource mobilization opportunities, we will be based on this regional framework roadmap to be the foundation for a coordinated development of the proposals. Next slide, please. So what steps we have taken so far to co-create this pandemic fund proposal second round? So as soon as this second round of a call was released from the pandemic fund, late December, Seattle circulated an email to all the country offices, and then through country office to the countries to prepare discussion, how we would like to prepare for the second round of the call for the proposals. And since the beginning of this year, we are repeating a call with WHO country offices, sometimes inviting Ministry of Health, and then other stakeholders and the implementing entities. We have reviewed the feedbacks from our first round of proposals, reviewed the priorities based on SPA, JE, PBS findings, regional frameworks, and then we are coordinating between single country proposal and the multi-country proposals in order to really avoid the duplication, but also create complementarity and synergies. And then we are, of course, collaborating with other implementing entities, and particularly for multi-country proposal, we are working with the World Bank, UNICEF, and the FAO together, and then engaging a couple of delivery partners. At this moment, these 6 countries listed are preparing the single country proposals because Nepal and Bhutan and India were successful from the first round. And then DPRK and then Myanmar, DPRK is not eligible, and then Myanmar is not preparing for single country proposal. For multi-country proposal, at least 6 countries really, 1, 2, 3, 4, 5 countries expressed interest in participating. And then Bangladesh and Thailand are currently in the discussion to be part of this multi-country proposal facilitated by Seattle. Next and last slide, please. So this is a priorities identified for our multi-country proposal for the countries in WHO Southeast Asia regions or surveillance and early warning systems. We would like to feature this multi-source collaborative surveillance, as Brett explained, not just strengthening the surveillance capacities, but how we can enhance collaborations among the surveillance stakeholders so that we can really utilize multi-source information to guide decision-making, public health intelligence, including establishing strengthening of the regional community of EIOS, wastewater, and then the genomic surveillance is another priorities for surveillance and laboratories. Enhanced use of this environmental data, including climate data, entomological data for arbovirus control. Community-based participatory surveillance, we will be working closely with the UNICEF and IFRC. On the laboratory front, a multidisciplinary regional reference diagnostic network using One Health approach, which include the recognition program, but also the simulation exercise, as Sebastian mentioned, a regional framework to strengthen quality management system for quality testing, data generation sharing. This also includes regional external quality assessment schemes. And then some of the public health work for strengthening related to surveillance include the field epidemiology capacity strengthening, regional trainings, as well as strengthening the quality improvement of the training approaches. One Health field epidemiology, the publication of this competency framework will be applied. Regional FETP communities will be strengthened. On the laboratory side, Global Laboratory Leadership Program, as mentioned by Sebastian, will be supported, strengthened in our regions. So these are something we are currently working together with our member states, country office, and then other implementing entities for the preparation for the second round. If you have any questions, let us know. Over to you. Thank you.
Great. Thanks a lot, Masai, and also to Dr. Arun for those country and regional reflections. Prior to this webinar, we had conducted a pre-webinar questionnaire survey to be able to understand some of the country questions that colleagues would like to have answered on this webinar. So I'll head over to those questions. And the first one is on labs. So perhaps this is for you, Brett. Describe the linkages between the approaches mentioned and the linkage to existing national interventions, i.e. SORMAS, to strengthen national surveillance systems and outbreak response in real time. Perhaps in your response, you could also expand on what SORMAS is for those who are not able to understand that. Over to you, Brett.
Thank you very much for the question. The SORMAS is a digital tool that assists with data collection, data management, and visualization. I just really highlight that this is one product that is available out of a suite of different sort of data collection and surveillance tools. Really, if a country decides that implementing a digital tool as part of the pandemic fund proposals is the right way to go, I think this is commendable. Digital tools do provide us a great avenue to improve data quality, to improve data integration, to be able to improve the timeliness of output, and also decrease the burden on our health systems to be able to collect such data. I just maybe highlight a few things that would be helpful, and not necessarily focusing on this one tool, but while you're looking at your options available, consider if such a tool is perhaps open source. Does it allow for some local adaptation so that you can find a resource that best suits your local needs? Does it allow for integration of surveillance and response activities into one place so that you have sort of that end-to-end process to be able to both conduct routine epidemiological monitoring and respond to threats as they occur? Does it allow for integration of different data sources? For example, data coming from laboratories, from hospitals, from environmental surveillance. These all need to be triangulated, and having that sort of triangulation in a common tool is really helpful. And perhaps finally, does it facilitate the information data exchange between partners, between countries, that allows sort of that more seamless communication, not necessarily having to do things manually, but having some processes also automated. And finally, just to really highlight that a tool can get you so far. It's really useful to improve data quality, to improve the data management, but at the same time, you do need to be investing on the other side of the spectrum to be able to then digest, to interpret that information and communicate it in a way that allows for public health decision makers to be made. So any investments in tools need to be also matched in investments in capacity. I welcome colleagues on the response division also to complement. I see Boris has put his hand up. Perhaps he wants to come in on this as well. Thank you.
Yeah, thanks a lot, Brett. And we do have an additional panelist perspective from Boris Pavlin, who is from one of the teams in WHO headquarters. So over to you, Boris.
Hi, thanks. A pleasure to be here. From our side, in the response division, one of the things that we see as very important is the ability to pivot your kind of peacetime surveillance towards being able to capture the relevant information in an emergency. And what Brett just mentioned, that the tool you use is important, but what's more important is the design of the system and where you get your data, how reliably people report into it, and so on, and also the agility of the system. In other words, can you use the existing system that you use for peacetime surveillance to also capture events in an emergency? What happens if all of your health systems health facilities are destroyed and you need to institute a new surveillance system? What if you need something that comes that you need more regularly than say monthly, and you need very real-time reporting on a smaller number of diseases, so that you can immediately react to them rather than the kind of more long-term surveillance for programmatic purposes. So, that early warning, alert, and response, and as Brett said, having an end-to-end ability to detect an event, verify that it's real, risk assess it, and then respond to it is crucial. And while I have the floor in the sort of vein of collaborative surveillance, one of the other things that we've recently found very important is the ability to link specific data sets. In COVID, for example, the clinical data from how patients disease was evolving, what their symptoms were, how severe they were, and so on, was very difficult to link with what their vaccination history was. Sometimes the clinical record would have that, but often it wouldn't. And more importantly, being able to relate that to the actual laboratory findings, specifically the genomic information about whatever COVID, SARS-CoV-2 strain that they had, whatever recent variant. And so, and in order to understand whether an emerging variant, and this goes far beyond just COVID, many diseases follow this sort of pattern where understanding variants, or for example, specific influenza subtypes, is crucial to link to the clinical data and also the vaccination data. Without the clinical data, we don't know if we're seeing more severe disease. Without the vaccination data, we don't know if we're seeing, vaccine failure, vaccine waning, and so on. And so I would, if I can make two pleas, one is to be able to have a surveillance system that can pivot, or an alternative mechanism for when there's an emergency and you need to go down from your routine 50 diseases monthly surveillance to something that really detects the outbreak-prone diseases, maybe 10 of them in real time. And the second plea, to be able to link relevant data sets to characterize the outbreak that you're dealing with. Over.
Great. Thanks a lot, Boris, for those important additions. The second question, I believe, is for Sebastian, but also to our country office colleagues in Nepal and also our region. So the question is, for labs, how might the interventions or strategies presented be adapted for various country contexts? For example, countries that are fragile, are currently in vulnerable or conflict-affected situations, those that are in low resource settings, as well as those that are in transition. So perhaps Sebastian, I'll come to you first and then come to Arun and then Messiah and any other colleagues who like to share their thoughts. Keep it in mind that we only have a few minutes, so if we can keep the responses tight.
Thanks, Nana. I will be short. First of all, countries facing a conflict might be different from countries with limited resources or countries with economies in transition, and it can be a combination of that. So I think all the time it will have to be adapted to the country context. Having said that, I think that given the vulnerabilities of these countries, it's important to focus on the essential services. For instance, at national level, making sure your national reference laboratories can provide the basic test to confirm disease, the priority disease, and then have the capacity to refer specimens abroad for further testing, for instance. At subnational level, focusing on the few rapid tests that could be stockpiled and used according to testing algorithm for screening. I think what is important is to look at the ability, I would say, agility to scale up and scale down your laboratory services. For instance, how to use mobile laboratories or how to strengthen rapid response team or emergency medical teams to bring the relevant laboratory services that should be included in these emergency workforce or deployment solutions. And my last point is about maybe the importance to maybe not look at so much the long-term preparedness and capacity building, but look at short-term readiness, because these countries are facing a lot of sudden acute events, and for which you don't have time to prepare. You have to adapt your system that is in place and make it fit for your purpose. So it's really to see how you can really very, very quickly adapt your system, updating your SOPs, stockpiling the critical reagents, do some refresher training courses, so that you can, in 2 to 3 weeks, be ready to respond. I stop here and turn to my colleagues. Thanks.
Yeah, thank you, Sebastian. I agree with you. And in the Nepal's context is that Nepal is recently become a federated state. It was a centrally administered state, and now it is federated state with 7 provinces. So provinces has a now provincial public health lab, and provincial public health system is being developed. So our proposal is very well adapted to that scenario, and also the local level, it is municipalities. And as Sebastian mentioned, that at national level, 1 level of testing for emerging pathogens, etc. And for the provincial level, there is a limited or selected number of testing capacity developed. And this municipality level, it is been linked to the rapid response teams, which will be developed or which will be capacitated during the coming years. And the labs are linked. We use a tiered diagnostic approach. The country has already developed a national essential in vitro diagnostic list. It is just approved in February 2024. Over to you. Over to you, Masai.
I am not a laboratory person, so probably I will keep it very brief. I think depending on the context, I think it's very important to identify the strategy tailored to the country context. For example, small island states probably don't necessarily have all the laboratory capacities, but I think creating this regional network is very probably critical. And then I think Sebastian also mentioned about the simulation exercise, but observing the current situation, probably there is probably good space to further create more efficient shipment procedures so that we can really get access to the timely results. Maybe I would stop here and then yes, over to you. Thank you.
Great. Thanks a lot, Messiah. Thanks to everyone. I think we've had a rich round of presentations, but also a rich round of questions. And so we can begin to perhaps wrap up this webinar. But as I move to wrap up the webinar, I just wanted to flag that there is a question in the chat function specifically on the labs piece from Basile. So Sebastian, I don't know if you could kindly respond to that question in the chat box. That would be greatly appreciated. Next slide, please. So in closing, just to highlight that this is on your screen right now, these are links to additional resources that can support countries as you develop your proposals for the pandemic fund second round, and also broadly as you look to develop national plans that focus specifically on looking at various ways for sustainable financing approaches. Next slide. Also wanted to flag that we are having a series of webinars dedicated to supporting countries in developing their proposals for the second round. For this week specifically, we're focusing in on the technical areas of the pandemic fund. So today we focused more on labs and surveillance. Tomorrow there's a focus session on health workforce. Thursday, we will be looking at the cross-cutting areas of gender, equity, and human rights, as well as civil society and community engagement. And then on Friday, we're bringing together all the implementing entities to showcase and share how the implementing entities are working together to be able to support ministries of health and also broadly governments as they move forward in terms of preparing and building and strengthening their capabilities for preparedness overall. And next slide. Again, just wanted to say thank you for being with us today, particularly to our panelists, but also to you all as attendees for spending the time with us today. If you have any questions, please do email us at whespp@who.int. We also would love to get your feedback on how we can improve upon these webinars. So please do take a shot of the QSR code that is in front of you, and please do provide us with feedback. We will share the recording as well as the associated slides with those that are on this webinar today, but also the many number of people who registered but were not able to be with us today. So in closing, just to thank you all, and I hope to see many of you during tomorrow's webinar as well. Thanks everyone, and have a good day.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you and goodbye.